Um, I'm a new athletic training student at Emory Henry College, and um, we came in for in services pretty early before anyone else returned, and hadn't really set in yet that we had so much to do. Then football got here, and preseason got here, and as a new athletic training student, you kind of just get thrown in, just like you join the group, you join the big family, but you aren't as when we took intro, for instance, we had to just observe. You can't touch anyone, you can't touch anything. All you can really do is clean. Um, but to get to actually do things hands on, help with treatment, help with rehab, you get to tape now, you get to stretch, and it is so exciting that I actually get to do things now. Because, yeah, practicals are fun, you get to practice on each other, but like the real thing and seeing how athletes prefer one thing over the other, one stretch over the other, one tape job over another, um, what they would do for pain, and if they just have different opinions on what they think, but you're the one that's learning it, so you have different ideas, and maybe you can help them return to play quicker, which is really cool. Um, I did imagine being a new athletic training student to be very, very, very overwhelming. But as I was thinking about it, I think that it's actually been good for me to be this busy because I'm really not good with free time because I don't get things done. So if I'm busy, I have a list, I have a schedule, I have my planner, and I get things done, and I get it. Like, I am so excited to be busy, which is probably unheard of. But I'm so excited to be busy and like learning new things and like, yeah, getting up early. Everyone complains, but I'm kind of excited to be getting up early because you get to learn new things, learn new treatment, get to ask new questions. Um, we get, as the new students, we are just kind of tossed in, and we don't know all the anatomy. We do not know all the special tests. We don't know all the mechanism of injuries. Um, we don't know many things, but getting up every morning and yeah, going through soccer and preseason is kind of tough with athletic training and being in clinical rotations, but um, I'm more excited than nervous, which is good. Um, what has been the most difficult has probably been balancing school that has just now started with hours and with being in our fall season of soccer, not taking on too many hours because you have to have time to do your homework and study, and also you have practice sometimes in the morning really early, sometimes late, so your schedule's really weird, and it's a lot to handle to try to schedule a couple weeks or a week in advance to get AT hours, but kind of keeps me sane, so I'm really not that worried about it. What helped me the most with that is my planner. It is full, it is color coded. Also, one of my close friends that I also play with has gotten in the program, and our class has already become so close, and I'm so excited to see um, how far we go together because our chemistry is great, and we already help each other so much, and more like a little family joining another big family like with the upperclassmen. Um, but my main goals for the semester are to, I really am interested in the, just with being in football preseason and doing my first rotation with volleyball, the difference in the ankle taping, and um, even if they have the same injury, even the same grade, they would want, a football player would want something completely different than a volleyball player would for their ankle tape, and um, volleyball has to jump, so they really don't want them to be their tape job to be so constrictive, but they want it tight and they want it to work, and you have to be able to make sure that they can't invert and evert and keep their ankle stable in that point so they can still play. But football, they totally want complete stability. They don't want their ankle to move at all, and they most of the time they want it so tight to where they can't even feel their ankles. But you can do so many things with ankle taping, especially with being in preseason. You see the different types of angles and what they do. You can do an arch tape with ankle taping, but also you use moleskin and help stabilize that. You can use moleskin for the stirrups or even the heel locks or the figure eights, just depending how unstable they are, because some people would rather prefer a brace than ankle taping, or someone prefers a ankle tape over a brace, and I guess it's just with how comfortable the athlete feels. But I'm really interested in finding out all the different ways to, or the different materials that you can use to stabilize the ankle when taping, and the different tricks that you can use to keep an athlete in their sport and not restrict them too much, but keep them from hurting themselves even more if they have sprained their ankle a grade 1 or grade 2 and they can still play. And because you don't want to hinder them in the athletics, but you do want to keep them safe and, from worsening that injury. But I'm really excited for that, to get into that and asking questions. I've already started watching different preceptors do ankles, and the tape they prefer or where they. One of my other goals this semester is to really understand the modality, I guess, why people prefer one over the other, because some athletes are so used to getting one treatment that that's all they think that they need, and someone will come in and they've always gotten ultrasound and that's what they want because they think they feel better. But we are learning that most of the time modality is just for kind of just like a mental healing process to help you think that you're getting better, but really it's genetics and many other factors that go into who heals faster than the other person if they have the same injury, same spot, everything. It just depends on the mindset, how, it depends on how their anatomy is, and but I'm really interested in seeing why people choose one or the other. Even preceptors have their favorites, and think that this one does this for the other. This one does, one will do something for an injury that this one won't. And we have modalities class this semester, which is really going to help me learn and get into it, because I'm also an athlete, so I've gotten stim and ultrasound and heat and ice and the cold and warm whirlpools and laser therapy and all of that. But just to see and get into how much one of those helps an athlete. But I'm most interested in the stim and how that, potentially can help repair muscles, and the contracting makes it better for the healing process. And my one of this goal is to really just kind of get into what benefits these modalities have, and specifically for injuries and examples, and because as I progress as an athletic training student, I want to have my own opinions about modalities as our own preceptors do in our clinic. And I'm really excited for this semester and to get everything started and to get in the groove of being, by the athlete's side, on the sideline, being there, being prepared for the fall or anything like that. I am so excited to get started. We have started, but classes have just started. We're now getting into learning more things that's going to help us get more information and really know more, and can help the athletes more. So instead of this year in preseason when our class was thrown in to football, they came up to us and asked us questions, and we wouldn't know because we don't know the anatomy, we don't know previous patient history, we don't know anything like that. So now that we're gaining the relationships with the athletes, now that we are in the program, and we are learning more ways to help them, and learning the anatomy and mechanism of injuries, and rehabs, and how modalities can help, everything like that. And it's going to be great. And I'm really excited. And this video is really long, so you'll probably see how excited I am. And I'm rambling, so bye.